Come on in, I'll give you a tour.
PM Pediatrics, Asia speaking.
PM Pediatrics is an after-hours pediatric office.
Deep breath.
For urgent care for children up to the age of 21. When your pediatrician is closed is when we open. It is designed as an alternative to the emergency department. All of my staff at PM Pediatrics are pediatric trained staff. We always have a doctor here who's trained in pediatric emergency medicine. Some parents come here if there's something that would need it to go to an emergency department, we can take care of it. So if somebody's having trouble breathing, if a child is having an acute allergic reaction, those things would go to an emergency room, but we are we always have a pediatric ER trained physician here. So we can handle those type of emergencies, but it does not have to be an emergency to come to PM Pediatrics.
Oh, I don't see Mickey. Who do I see? Do I see Minnie?
You can come to Pediatrics for any concern. Ear pain starting that evening when your pediatrician is closed, or if your child comes home from school and complains of a sore throat. So it does not necessarily have to be an emergency to come here. This is our procedure room. Our office is decorated as a Main Street USA theme because a lot of the Westchester towns started as small towns. So a lot of our rooms are different stores on Main Street. This is where we take x-rays. We have x-ray technicians who take the films. Sometimes if the x-ray technician's not here, the physician will take the film, and we have a radiologist who rereads the films within 24 to 48 hours. We can get a variety of labs here at PM Pediatrics. We can get a urine test, we can get a CBC, which can tell us possibly the type of infection your child has. We can get chemistries, so if we're worried about dehydration, those lab tests can help us further diagnose what's wrong. And as well, we have multiple rapid tests here. One of the most common ones we do is a rapid strep test, so we can know within 10 minutes if your child has strep. And if that test is negative, we send a follow-up culture to the lab, and then we'll know within 24 to 48 hours if your child has strep throat.
Big say ah. Ah. Good job.
Whether it's ear pain late at night, croup and respiratory distress at night, or a stomach virus and you and your pediatrician are worried about dehydration, or a sporting injury on the weekend, it's important to know that you can come to PM Pediatrics.